I'm doing a head to toe. So I'll knock on the door, introduce myself. Hi, I'm Charity. I'm your student nurse. I'll be doing an assessment on you today. Can you tell me your name and date of birth? And tell me their name and date of birth. I'll ask a few questions. Do you know why you're here? Are you having any pain? What is your appetite like? When was your last bowel movement? Stuff like that. I will get the vitals. I'll do the temperature, respirations, pulse, blood pressure. And if they said they were in pain, I will ask on a scale from 0 to 10, what is your pain level? 0 being none and 10 being the worst. And then I'll go like check the head for like lacerations, knots, cysts, like soft bumps or anything. Oh, then I get my pen light. I don't have one, sorry. And I'll do the eyes, make sure they're good, and then do the test. Make sure that do the perla. And while I have the pen light, I'll check the ears. Make sure that they are not like red or swollen. I'll look in the nose. I'll ask if they can hold one nostril and blow, and then do the other side. Look in their mouth, make sure there's no lesions or anything like that. Ask them if there were dentures. Ask them to swallow for me, or maybe that's when I get to the neck. But look in the mouth. Make sure like their things not swollen or anything. And then I'll go down to the neck area. I'm gonna turn it this way. I'll start like behind the ears. The ears be right here. Ears, and go down, then come back up, and then I ask them to swallow, and then find the carotid artery, and then that's when I will listen to that. Just put that there. Listen for that. And then while they're sitting still with my stethoscope, I listen to their chest. So here, 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 here. I think I did it. Yeah, and then here, and now here. And then I'll listen to the back. Let's see if you can see it. I'm gonna see if I do this right. Here, here, here. Hold on. Here, 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 and there. And everything sounded good. And while I was doing that, I'll have them like either hold their breath or cough for me. The cardiac, I'll ask for them to lay flat, lay on their back. I don't know if you can see it. Okay, lay on their back. And then I'm gonna find the fifth, like the apical pulse, and that's through the fifth intercostal. Go down and listen to that for a full 60 seconds. And then while I have them on their back, I'll start inspecting like their abdomen. The first thing I'll do is look at it, make sure there's like no incisions or it's not bloating, stuff like that. And I'll listen. Oh yeah, I gotta listen to the 4 quadrants. So and it should have something like, it shouldn't just be like, if you should hear something. And then I'm gonna palpate upwards on the abdomen. And I can ask questions that's like, when any change in your bowel movement, have you lost any weight? Like, is there any pain while I'm pressing on your stomach? And then ask about the urine. Is it, oh, sorry. Is it like clear, yellow, cloudy? Ask about their appetite. Have they been drinking regularly? And then while I have them down, I can check the extremities of like, I'm gonna check the pulses, the radial pulse and stuff like that. Just check for any scars, and then when I go down to the, like, just check for edema. But while I get this pedal pulse, and just like inspect the legs and everything for like lesions, edemas, and ask, is there any pain? You should do, yeah, and just make sure like the color is right. You could do the capillary refill either on the hands or on the toes. Oh, another thing, check for like dehydration. So like pinch this part right here or your forehead. Miss Lucas said no pinching of the hand, no tinting, no. So oh, we could do range of motion while they're here. Like, can you lift your leg, lift your arm? Have them sit back up. Have them like cross their legs. If they're sitting, have them. This was another thing that I missed. The reflexes, the knee hammer thing. You could have did that while they were sitting. See if they could cross their legs, like bend their arms and stuff like that. You could do, that's just doing range of motion. Ask if they have any history of falls. And then do the strength. I should have did that while he was laying down, so I'm gonna go back. While they're laying down, you can like press your feet. I mean, pull your feet towards your nose and then press on my hands. And we could do the same, like with the fingers, test their strength, and do this while they sitting up, and press against theirs, make them press, and then like don't let me push your hands. Make sure they squeeze your fingers at the same time. Sorry. At the same time. And then if they are able to walk, you have them get up and walk to the door, walk back, do the Romberg's test. I believe that's what that's called. And document everything. And let me make sure I didn't forget anything. Ask them if they wear hearing aids. I did forget that while you're checking the ear. Just ask them if they wear any hearing aids, if they have any dentures, any partials and stuff when you look in their mouth. And while you're talking to them, you can assess like their speech and stuff, if they're able to comprehend, if they oriented, like their lack of consciousness and stuff like that. You could tell if just by looking at them, they're, I don't want to say that because that's kind of judging the book, but if they have, like, you know, if their hygiene is okay. It says body position and like skin color, make sure like they're not like pale or anything. So some of that you can just assess by literally walking in and just looking at the patient. And I don't know if I said it, but just ask, has anything changed lately? My phone was going dead, sorry. Ask them, has anything changed lately? Their appetite, anything like sleep habits, their bowels, have they felt constipated and stuff like that. So that is basically it. Thank you.